This donning procedure assumes the facility has selected to use an N95 respirator with a coverall. An established protocol facilitates training and compliance. Use a trained observer to verify successful compliance with the protocol. The trained observer will read aloud to the healthcare provider each step in the donning procedural checklist and visually confirm and document that the step has been completed correctly. The trained observer in the donning process is a dedicated individual with the sole responsibility of ensuring adherence to the entire donning process. The donning process is conducted under the guidance and supervision of a trained observer who confirms visually that all personal protective equipment is serviceable and has been donned successfully. The trained observer should suggest to the healthcare provider that he or she attend to personal needs, such as using the restroom and hydration, prior to donning personal protective equipment. The trained observer uses verbal commands and a written checklist to confirm each step in donning personal protective equipment and can assist with ensuring and verifying the integrity of the ensemble. No exposed skin or hair should be visible at the conclusion of the donning process.
Hi, welcome. We're ready to go see the patient. Are you ready? Well, great. So we're going to go into the unit and we're going to do this safely. We're going to do everything slowly and methodically. And if you have any questions at all, you can stop and ask.
Before starting the donning procedure, change into clean surgical scrubs or provided disposable garments and dedicated washable footwear, such as plastic or rubber materials, in a suitable, clean area. All footwear should be closed-toe and closed-heel with no holes. No personal items such as jewelry, watches, cell phones, pagers, or pens should be brought into the patient room. Ensure hair is pulled back, away from the face, and off the neck and back. Ensure that your nails are no longer than 1/4 of an inch so they do not puncture the gloves. Visually inspect the personal protective equipment ensemble to be worn to ensure that it is in serviceable condition and that all required personal protective equipment and supplies are available and that the sizes selected are correct for the healthcare provider. The trained observer reviews the donning sequence with the healthcare provider before the healthcare provider begins the donning process and reads it to the healthcare provider in a step-by-step fashion using a checklist.
Okay, great. Before we do any kind of procedure, we're going to do proper hand hygiene. Remember to do hand hygiene between your fingers and on the back of your hands and the palms. And we're going to make sure that we let the alcohol gel dry before we proceed. So next, we're going to put on the booties. We're going to pull up a chair for your safety, and you're going to sit down and put on the booties. Once you get the booties on, we want to make sure they're secured around your ankle and your calves.
Make sure that all areas of the foot are covered and the boot covers are snug over your ankle and calf. If your boot covers have a strap, wrap the strap around for a comfortable fit. Try not to touch the floor or other areas with your hands while putting the boot covers on. If you do, disinfect your hands before putting your inner gloves on.
Okay, now we need to put on a pair of gloves. This is not a sterile procedure.
Put on the first pair of gloves. Make sure to get the cuffs of the glove as far up as possible.
Now I'd like you to put on the coverall.
If available, coveralls with thumb hooks help secure the cuffs over the inner glove to help ensure there is not a gap between the glove and the cuff of the coverall. Pull up the zipper completely. Ensure the coverall is large enough to allow unrestricted freedom of movement. Ensure cuffs of inner gloves are tucked under the sleeve of the coverall. If a coverall with thumb hooks is not used, facilities may consider taping the sleeve of the coverall over the inner glove to prevent potential skin exposure from separation between the sleeve and inner glove during activity. If taping is used, a tab should be created by folding the tape over at the end. This tab will help facilitate easy removal during the doffing process. Care must be taken to remove tape gently. Experience from some facilities suggests that taping may increase risk by making the doffing process more difficult.
Now put on the N95 respirator.
Hold the respirator in the palm of your hand with the straps facing the floor. Place the N95 respirator on your face, covering your nose and mouth. Pull the bottom strap up and over the top of your head, and put it behind your head below your ears. Take the upper strap and put it behind your head towards the crown of your head. Mold the nosepiece of the respirator over the bridge of your nose to obtain a tight seal. Always follow the manufacturer's instructions for wearing a respirator. Perform a fit check to ensure there is a good seal against the skin.
Now we're going to inspect the hood before we put it on.
Be certain the hood completely covers the ears and neck. The trained observer should check to ensure the hood is in place and that all parts of the skin are covered. No hair is hanging down, and the hood extends to the shoulders.
So now we're going to put on the apron. We're going to take the apron, put it over our heads methodically and slowly, and then we're going to tie it around the back.
If the patient is having vomiting or diarrhea, put on a single-use, fluid-resistant, or impermeable apron that covers the torso to the level of the mid-calf. The apron provides an additional layer of protection to the front of the body against exposure to body fluids or excrement from the patient.
Now it's time to put on your outer gloves.
It may be necessary to ask your trained observer for assistance when putting on the outer gloves. Double gloving provides an extra layer of safety during direct patient care and during the personal protective equipment removal process. Some facilities have found that using different colored gloves for the outer gloves is beneficial. Utilizing different colored gloves for each layer helps to rapidly identify any breaches in glove integrity.
Next, you're going to put on your face shield. In order to do this, you're going to have to bend forward slightly. With the face shield facing towards you, take your thumbs inside the elastic straps, placing the foam on your forehead and stretching the elastic band and placing it behind your head.
Once the shield is situated, check to make sure it covers the front and sides of the face and no areas are left uncovered.
Okay, now I want to make sure you have full range of motion. Can you move your arms? Can you bend at the waist? Can you turn around a little bit so I can make sure everything is just ready for you to go?
After completing the donning process, the integrity of the ensemble is verified by the trained observer. A mirror in the room can be useful for the healthcare provider while donning personal protective equipment.
Everything looks great. Now we're ready to take care of the patient.
Before you move to the patient's room and into the doffing area, you will need to take a few minutes to do some important things. First, get the attention of the trained observer. Once he or she signals to you that it's clear, enter the doffing area. Inspect your personal protective equipment. Are there any obvious signs of contamination or materials on it? If so, you will need to disinfect the surface of the personal protective equipment with an EPA-designated disinfectant wipe. Last, disinfect your gloves, also with an EPA-designated disinfectant wipe, or alcohol-based hand rub. You, your trained observer, and the assistant are a team throughout the doffing process. The trained observer will read each step aloud, giving you the time to take the required action. The assistant will help you when necessary. Remember, don't rush through the doffing process. Take your time and be careful.
I'm here to help you through the doffing process. You'll hear me give you directions that aren't part of standard process, but they're designed to keep you safe. We need to check for any rips, tears, or contaminants on your clothes. Remember, go slowly and do not touch your face. As you remove each item, remember to place it immediately into the designated waste receptacle. Let's work through this together. Now, I'd like you to disinfect your outer gloves.
The first thing you will need to do is use an EPA-registered disinfectant wipe or an alcohol-based hand rub to disinfect your outer gloves. The wipe will be used for any visible contamination.
Okay, great. Before we do any kind of procedure, we're going to do proper hand hygiene. Remember to do hand hygiene between your fingers and on the back of your hands and the palms, and we're going to make sure that we let the alcohol gel dry before we proceed. Now, I'd like you to disinfect your outer gloves.
In this example, the boots are under the coverall and are being removed later in the sequence. However, depending on the personal protective equipment used at your institution, the boots or shoe covers may be removed at this point in the sequence or later on in the sequence. There are two very important things to remember. First, pay special attention so that you don't contaminate or tear the inner glove. Second, don't snap the gloves, which could cause spray.
In the next step, you're going to remove your outer gloves. Please do this slowly to avoid contaminating or tearing the inner gloves.
Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then, roll it down until the glove is completely off your hand, in a ball, in the palm of the other hand. Then, slide a finger down and inside the outer glove on the other hand, and pull it off until it's balled around the first glove. Dispose of the gloves.
Now inspect both sides of your inner gloves, looking for tears or contamination.
If you do see a tear, hole, or signs of contamination of the inner gloves, disinfect with EPA-registered disinfectant wipes or alcohol-based hand rub. Then, remove the inner gloves, making sure not to contaminate your bare hands. Once the gloves are off, perform hand hygiene with alcohol-based hand rub on your hands. Then, put on a new set of gloves up to the edge of the coverall sleeve.
Now you're going to take off your face shield. As you move it forward over your head, avoid touching the front of the shield.
To remove the face shield, tilt your head forward slightly. Grab the strap at the temples and pull it forward and over your head, which will let the face shield fall from your face. Dispose of the face shield.
Disinfect your inner gloves again.
To remove the hood, tilt your head slightly. Grasp at the crown of the head, and use one hand to pull the hood forward, away from the body, and off of the head. Dispose of it.
Disinfect your inner gloves. Next, you will remove your coverall.
If your coverall has a flap covering the zipper, you must gently pull it open. Then you will need to disinfect your gloves. Next, tilt your head back and reach for the zipper at the top of the suit, using a mirror to avoid touching the skin. Grasp the zipper with 2 fingers of one hand, without using the other hand, on the front of the suit, and pull down. Unzip completely. The assistant may help you unzip the coverall if necessary. The assistant will stand behind you and grasp the outside of the coverall at the shoulders, and pull it off your body in a downward motion until the coverall is off your shoulders completely. The assistant will then reposition his or her hands and roll the suit outward and down the back in a controlled fashion, removing your arms and slowly pulling it down until it's at your waist, being careful not to touch your scrubs or skin. To get the coverall off the rest of the way, you may need to sit down in a clean chair. Grab the coverall and pull it away from your body, one leg at a time. Once the coverall is off completely, dispose of it.
Because you just removed your coverall, I'm going to ask you to disinfect your gloves one more time before we change them.
Sit in the designated clean chair to take off your boot covers only. Once you sit down, be careful not to touch one leg with the other. Then, grasp the outside of the boot cover and pull down toward your ankle. Then, lift the boot cover over your heel. Pull it off your foot and dispose of it correctly. The exact way to remove the boot covers will vary based on the manufacturer's instructions.
Move slowly and deliberately to avoid contamination of exposed surfaces. You're doing great. Please do this slowly to avoid tearing the gloves or contaminating your hands.
It's important that you don't touch your face or any other exposed skin with your bare hands now.
Now that your gloves are off, make sure you don't touch your face or any exposed skin.
Perform hand hygiene, using alcohol-based hand rub only. Then put on a fresh pair of gloves and you're ready for the next step. Next, you will be removing your N95 respirator. It's important that you not touch the front of the respirator. Pull to the sides, then over your head. Next, use both hands to grab the upper strap. Pull to the sides, then over your head. Keep tension on the upper strap as you remove it, which will let the mask fall forward. Dispose of the mask.
You're doing great. Now disinfect your gloves. Please have a seat in the clean chair so you can disinfect your shoes.
To disinfect your shoes, sit down in the clean chair. Once you're sitting down, use the EPA-registered disinfectant wipes to thoroughly disinfect all the surfaces of your shoes, moving from top to bottom, and including the soles. Be sure not to touch your ankles. Now it's time to remove the inner gloves. Like with the outer gloves, there are two very important things to remember. First, pay special attention so that you don't contaminate your hands. Second, don't snap the gloves, which could cause spray.
Please do this slowly to avoid tearing the gloves or contaminating your hands.
Hold one of your wrists so that your thumb points up. Pinch that glove and lift at the wrist. Then roll it down until the glove is completely off in a ball in the palm of the other hand. Then, slide a finger down and inside the glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves. Once your gloves are off, it's very important that you don't touch your face, any exposed skin, or any surface in the room.
Now that your gloves are off, make sure you don't touch your face or any exposed skin. Okay, one more important step. We need to check for any rips, tears, or contaminants on your clothes. Please hold your hands out to your side and slowly turn around. Okay, everything looks great.
Congratulations! You've now successfully finished the doffing process, so you can leave the doffing area. You need to find the closest designated shower where you can remove your scrubs and bathe with soap and water. A shower is recommended at the end of each shift.